Thank you so much for offering, inviting me to be a guest on the podcast. I'm excited to talk about this. I don't often really get a chance to talk about the medic pain medication situation in my recovery. I do so much work around ancestral clearing and the burden. That's part of the work that I do in the world is ancestral clearing. And I just do a lot of, because that's just not a topic that people talk about. So I'm pretty popular on podcasts that want to hear that message. So, but I don't have the opportunity to get on recovery too often and talk about this. So I'm excited.
Yeah, and me, because I think it's one of those things that the obvious thing that comes to mind is alcohol or whatever, but painkillers are so important. My best friend, she can't get up in the morning without just taking paracetamol, and it's something
Okay.
that she not
That's
really
not,
worked
that's
on.
actually just Tylenol. That's the same thing. We call that Tylenol here.
Right.
Um, that's interesting because that's actually not addictive, but the
Yeah.
habit. We get addicted to our stress,
Yeah.
and that could be indicative of just, she's back in a stress pattern. She wakes up and there she is. Yeah,
I know she's cut it right down because she used to take
good.
like a couple of
It's hard
packets
on
a
the
day.
liver. It's hard on the liver. Yeah.
Yeah. So she has really cut it back, but she still can't get over those taking those two to get out of bed in the morning. So yeah, I'm really, really pleased that you're here because and my husband as well, he likes to reach for cocodamol, um, anything that might, and he's aware and he backs off nowadays,
Mhm.
but back in the day, anything that could be an addictive medication, or I need that, or I try that without a
Oh,
specific
yeah,
reason
that's
for
that's
it.
what it is. Yeah,
Yeah. So
yeah. That's
please tell me more.
uh are we recording? Oh, we are recording. Okay.
Yeah, we are recording.
Sorry. Yeah, so um I this all began, I had an accident when I was 14 and um broke a vertebrae in my spine, which when there's a whole reason that I had a chronic pain habit, a chronic pain experience going into that accident. So I was used to, which was more emotional, really, but I didn't, because emotional journals into physical, I didn't really understand the difference back in those days. And so that when I had that accident, I had, I fell off a horse and landed on a rock, and I had seen, I was an equestrian, and I had been in horse shows and stuff, and I'd seen people, riders fall off horses and get carted off in litters. So, and I was able to get up and walk. I knew I hurt my back, but I was able to get up and walk away from that accident. So I figured I was okay. It hurt, but I didn't do anything about it for 7 years.
Yeah.
When it finally, because the bone, it didn't just break. So it would have, at the age of 14, that bone would heal. What happened was it broke and it broke in two, front to back, and the front part slipped forward. So it couldn't actually heal. It kind of had to heal in that way anyway. So it pulled the leg nerves and it created some interesting effects in the legs and kind of strength stuff. And about 7 years later, I was working a fairly was working in a food co-op, and I was, lifting up like, 60 pound honey tins in each arm, carrying them upstairs and stuff. And that had an effect. Right. Right. I had no idea I had no idea the landscape. I just knew I kind of had a sore back, but we never took an x-ray. So I didn't understand really what was happening there. Anyway, I finally, I finally went to see a doctor because I couldn't get up the stairs, and I was like, maybe we should check this out. so so I looked at saw a bunch of different back doctors that look at the spine, And the first one was a chiropractor because I don't want surgery. And so I went to a chiropractor first, and they took an X-ray, and they was like, "Well, this is an old accident. This is an old injury." And I'm like, "Oh, I know when that happened." Right? And he showed it to me, and I was like, "Oh, I see what's happening here." And so anyway, the chiropractor said that he'd be able to help me manage that. And all the other back doctors said you need a spinal fusion. And I had kind of grown up with my parents' friends getting fusions, and my mother made such a stink about how scary they were that I was just like, I'm not going there. Right. So it was like the whole thing. But anyway, I um I went another 7 years under the care of a chiropractor until I got pregnant, and of course that created an imbalance, right? And about 9 months after I delivered, because I tried to hold the baby and stuff, it was creating like more imbalance, right? I That pain just got pretty epic, and I was still seeing the chiropractor, and he looked at me one day and he said, um, sometimes our patients need surgery, and you're one of them. And I was like, oh, okay, I guess we're going to change the tune here. So that began a series of 4 surgeries that I had. Three were reconstructive to kind of try and see if we could, because the slip kept, the bone kept slipping further and further, which is what the problem was with the pain. And so, anyway, I had 3 surgeries to kind of reconstructive and another one kind of corrective. And uh, as I went into that first one, that was when the pain meds began, and that was their answer, the opiates. And I had such a I had my nervous system was so hypervigilant, right? So new mom, hypervigilant. A new mom, yes, with a history of like a mother, a very difficult mother. So lots of questions about can I even be a good mother because I had such a difficult role model kind of thing. So lots of hypervigilance, right, which is not helping the pain.
Yeah.
And so they gave me opiates, and they gave me a benzodiazepine. So, which is an anti for everybody, just an anti-anxiety medicine to kind of they coupled those two, and it did calm me down enough for me to actually. I had to quit school. I was in college at the time on a graduate at the graduate level, and I had to quit my last was it my last 6 credits I couldn't complete because of the. I was just like okay, so so anyway that created. I had that one surgery, and then I had those others, and every time we increased the pain medicine levels because the pain was increasing, and that was their answer. And the other answer was, and this is the thing, this is one of the reasons why I like to come on podcasts. They said you can't heal from chronic pain. That was the understanding at the time. Now they don't. My understanding from the doctor that I worked with later, who actually understood the nature of chronic pain, told me that they don't teach doctors about pain in medical school. So, and other than take opiates or whatever, they don't teach about the physiology and all the things. They might nowadays, but in those days they didn't.
That gives you a lot of
Anyway,
hope, doesn't it?
yeah, and I had a science background. Like I said, I was in graduate school. I had learned to be. I was a plant science major, and I was studying environmental studies, and I was learning to be a researcher. And University of Kansas here in Lawrence, where I live, has a really really good biology department. They're just excellent in terms of teaching students how to be researchers. It's amazing. And I was so grateful for that because I got the prognosis. You can't, you have chronic pain diagnosis, prognosis, you can't heal from it, which devastated me. That was after my second surgery. And because I trusted the doctor, because they're the ones with the doctor degree, I don't have a doctor degree. What the hell do I know? Right. And I knew somewhere as I was devastated and all of that, some part of me knew that I was missing something and I didn't know what it was. And it took me 2 weeks to like sort it out. Right. And at the end of 2 weeks, I realized um, that doctor has forgotten his basic science because science is about probabilities, not facts. And he pronounced me. And doctors are not fortune tellers. So I learned from that, believe the diagnosis, but don't buy into the prognosis.
Yeah.
Right. And also because of my, background in science, I knew the paradigm shifted and he was operating on under a paradigm and he'd forgotten, you know, new information. We have new information. We have, new perspectives, right? So I knew these things and I was like, the other thing I knew was so important was, which hooks so beautifully into recovery, was science operates in a limited, self-limiting framework. It can only comment on that which it can observe, measure, describe. It can't comment outside of that.
Yeah.
And where do we live? We live in the all that is, which includes the scientific framework, but it includes everything outside of the scientific framework as well. And I knew that my healing, I was going to have to look both places for my healing. Right.
Yeah.
And that was the saving grace. That those professors that took me through those, oh my goodness, Elizabeth, that's not an important question. What? I mean, like all the stuff, right? All the redirection and my thinking and having to learn how to like, kind of harness the craziness, the wild, the wild nature of the mind into the scientific method paid off. Like that was hard work for me. But it paid off in that sense that I was able to actually navigate the mistake that my doctor made. And it wasn't just that one doctor, they made it, many of them made that mistake. So I was able to hold my space with them and say, yeah, well, working on that, you're telling me more about your model and the limitations of your model that you're working under than you are telling me about the human body's ability to heal.
Yeah.
Right. I never would have been able to put that stuff together if I hadn't been trained in research. I just didn't have the skill set. Right. So super important in it. And it really helped me keep searching because I was on those medications for 31 years. And the last 15 years, those opiates were fentanyl.
Wow.
So 15 years of fentanyl and with Ativan or another benzo was that's a long time, and it was something else being in recovery from that. But the reason that I was able to kind of get through all that was I had a real sense of higher power, and I also came in with the gift of persistence and perseverance, like that was, and gratitude. I had these gifts that I kind of came in with those things, and I'm kind of like a dog with a bone. When it's a problem, I'm gonna keep chewing on it until I solve it. It's kind of, or until I realize that it can't be solved. Like, that happens too. But I'm just saying, like, that's kind of my personality. So it's kind of how that.
Brilliant.
So that's how I managed. That's how I managed all that. Now, what happened? How did I get into recovery? I got 31 years into that, and I kept trying to get off the medication, and I couldn't. And at one point, I was just kind of like, you know what? I don't care about the pain anymore. The meds are messing with me on some level I can't even fathom. I knew that much.
Yeah.
One of the things that was very revealing to me was I was in a car with my son. He was living in Los Angeles at the time, and And we were, he was driving me to this event, and I was so excited about it. I was so excited to see him. So a very cheerful, joyful moment. And I had a panic attack. And I had been getting panic attacks. We will talk about those in a minute. I've been getting panic attacks for some years. And I couldn't, hear sciencey again, right? What's the pattern? The only pattern I could see was that there was no pattern. And that freaked me out. And my doctor didn't have anything to say, and the medical literature didn't have anything to say. Like the wrappers and all the instructions that go with the medicine. No,
Yeah.
not nothing, right? So it's not like I didn't do my research. So I'm sitting in the car with my son, and I have a panic attack, and I reach for my Ativan, which is in pill form. I put it in my mouth, I swallow it, and within about 30 seconds, the panic attack goes away. And I'm like, okay, that was not the Ativan. The Ativan did not do that because it takes like what, 20 minutes to get anyway. It's like something else is happening here.
Mm,
Something else is happening. Like I said, my own prescribing doctor, my behavior was just, it was just not something he understood how to handle. Anyway, so that was the beginning. Anyway, I found, through, again, my son, um, I knew someone in recovery, in the Los Angeles area, like it's almost the recovery capital of the world, really, in many ways. Beautiful recovery community there. And she knew this guy named Dr. Peter Prescott that worked at the Betty Ford Center, which is now a Hazleton a place.
oh yeah.
And Peter Prescott, and he called me, and uh, he said, I think your pain medicines may be causing your pain. And I was like, what? And and then I was like, and he said, and the next thing he said was, and I never told him that I was having panic attacks. He just knew the meds I was on. I didn't tell him anything else. The next thing he said was, and I can help you reset your stress response. He knew I was having panic attacks. And when he said that, I was like, I'm coming. When's the next bed? He
Yeah.
knew. He knew. And I, like my own doctor didn't know. So like my own prescribing doctor was like, I mean, he wanted to put me in a coma. When I asked him, can we get I'll put you in a coma. How many people have you done that with? None. And I'm like, I'm not gonna be your guinea pig. I was just like, no confidence. So I just, hear science. I kind of want to have some evidence, right?
Yeah.
And Peter Prescott had taken thousands of people off of meds, including this fentanyl benzo combo. And so I went into his program, and it was very powerful. I was in a detox bed for 12 days, and I kind of rolled out of it. They kind of poured me into a wheelchair, and I had, now hear me, I had pain in my low back for 40 years. And when I got up to get into the wheelchair, I had just enough strength, because you lay in a bed for 12 days, you're going to lose muscle tone, right? You're going to lose strength.
Yeah.
I had just enough strength to stand up and get in the wheelchair. And when I stood up, I noticed something. It was blatant. I didn't have any more pain in my back. And I was just like, holy crap. And it turns out part of my pain, I had gut pain, but I didn't have back pain. Part of that pain was something called hyperalgesia, which means the pain medicine causes pain, which was, I don't think that was even written about until 2010. And I went into treatment in 2013. So fairly new. I mean, research paper 2010, by the time it gets to little me, is, wow. It's like, right. So Peter, Dr. Prescott knew, right? So anyway, I finally get well enough to get into his pain management class. and there's 20 people just like me in the room, which was amazing to me because I've been isolated for so many years, and it was just kind of me and my husband and my son were all trying to navigate this thing with the doctor, and that's like we didn't have a recovery community. I didn't even know it existed, right? So I mean, I met lots and I talked to lots and lots of people and like thousands of people over the years in hospitals and hospital waiting rooms and doctors' offices and rehab centers, like physical rehab centers and places. Lots of us, right? But this was all new. The first thing that Dr. Prescott said was, "What are you doing to contribute to your pain?" Which freaked me out. And I was like, I mean, I immediately was on my, in my fighting mode. And I was like, how dare you ask that question in this room? Like, who are you? What's your problem? It's like the pain's doing it to me. I just was like, went right into that, right? And I'm in this energy, and all of a sudden in my mind, I heard, you know what it sounds like the old record 33 revolving records, the records where you've got it, there's a needle on it, and somebody goes rip, rip, with the. I heard
Yeah.
that sound in my head, which was like, wait a minute. And I heard the question again in my head, Elizabeth, to the room, what are you doing to contribute to your pain? And I realized that he had actually, in the question, he had implied that I actually had some power in this whole thing. Whereas I had completely felt victimized by the pain, he suggested in the subtext that I might have some power here. And wow. So he moved me from victimhood to empowerment with one question. And let me tell you, he had my attention. So yeah, attitude. And then now you've got my attention with one question, you know?
Amazing.
So that was very powerful for me. And then the next thing he said was, don't judge the moment. Again, attitude. I'm just sitting here minding my own business, not judging anything. That was what I had in my head. So it was my response in my head. I had to say it out loud, but I sure thought it. And then I was like, wait a minute. He's actually talking about my pain. I've been judging my pain as bad my whole life. And we're in a war, and that's just me. It's like we're in a war with pain. When we're kids and we're playing and somebody, bangs into somebody else and, right? And what happens? The adults in the area rush in and they do so lots of energy. Got to stop this, right? And they do everything they can to get us to calm down and to stop the pain. So what's the subtext of that? Pain is bad. We'll
I've
do
never
whatever we
thought of
have
it
to
like
get
that.
rid of the pain, right? So we've got a program. I got, and many of us get programmed that pain is bad and we're at a war with pain. Peter's like, you know, don't judge the moment. And I'm like, wow, okay. So first of all, I have power in this pain equation. And second of all, I'm judging my pain as bad, and that's part of the power problem. That's part of the power equation, right? So anyway, he was quite remarkable. He passed away in 2016, but he left us this beautiful book, Conquer Chronic Pain: An Innovative Mind-Body Approach.
Oh,
He's quite something. He took thousands of people through his pain management program, and then I wrote my book, The Way Through Chronic Pain: Tools to Reclaim Your Healing Power, which is his is the doctory researchery version of the chronic pain situation. Mine's the patient manual. Like this
amazing.
is from the patient point of view, right? And so it's kind of a nice combo, those two books. And
Yeah.
anyway, I walked into that program and I walked out. I walked in to the Betty Ford Center and put my medicine down. And I also put down cigarettes at the same time. So I was also had been a long time smoker. So all three of those things were typical addict. I'm going to do it all at once, right? Typical, right? Everything all at once, right? And I walked out of that program. So I walked in with 40 years of chronic pain, and I walked out 52 days later with no pain. Now I still had a stress habit in the nervous system, but I didn't have any physical pain. So that's, my nervous system was still like, what the hell just happened? And how do we calm down? And all that kind of stuff, dysregulated. But I didn't have the pain. And so I spent the next basically 5 years. I'm 11 and a half in recovery now, but I'm spent about the next 5 years actually what I would say taming my nervous system, reminding it, oh, we don't have to do life like this. We can do life. Let's do life like this. And I still, every morning, I get up and I do 11 minutes of a breath practice to remind my nervous system, this is how we can do life if we want to today. Right, right. So anyway,
Wow.
that's my story. I can talk a little bit more about the difficulty with pain medicine, if you want, because that was something that Peter was very clear about, and I was like, wow, my own doctor didn't even like bring that in. So my prescribing doctor didn't bring that in.
Yeah, that'd be really interesting.
So it's interesting. So let's just define chronic pain briefly for the audience. Chronic pain is any pain that's felt 15 days out of 30 for 3 months or more. Any pain, physical, mental, emotional, spiritual, financial. The brain can't tell the difference between one kind of pain and another. So it all sends the same signal to the brain. It hurts. So that's interesting because most people think chronic pain, physical. Mm-mm.
Yeah.
The brain interprets all that stuff as so grief can be a chronic pain experience if it lasts 15 days out of 30 for 3 months or more.
Yeah.
Right? A situation leading up to a divorce, if there's that kind of like contracted energy difficulty in a maybe abusive, maybe not abusive, but like difficulty in a relationship. Yeah. 3 months or more, chronic. Okay. So we've kind of defined what that is. And what does that mean? So in acute pain, so we have a stress response in the nervous system that helps us navigate life. And in acute pain, the stress response goes from the off to the on position. The body, there's a physiology and psychology that arises to meet the threat. We meet the threat, the stress response goes back into the off position. That's a balanced stress response. In chronic pain, the stress response gets stuck in the on position. And so now we're constantly in a physiology where we're meeting a threat, meeting a threat, meeting a threat. And no wonder it took me 5 freaking years to calm my nerve. I'm still working on that. And it's 11 years in, and I'm still reminding my nervous system, breathe. It's okay. We don't have to do this. So it's like we get addicted to stress. The nervous system, yeah, there's a whole physiology around that. Yeah, there's a whole way we could do a whole podcast just on that. Thank God there's a lot of neuroscience nowadays that kind of explains all that. So the stress response gets stuck in the on position. And what does that do to the brain? We talked about hypervigilance. It affects the emotional part of the brain in that now instead of having kind of a negative bias, which we all do, just kind of keep us surviving on the planet, we see something new, the first thing we think is no. Right? That keeps us safe. That's kind of pretty hardwired in the system. So, and thank God, because that's how many iterations of trial and error through generations gave us that gift, right? Now, in chronic pain, that negative bias gets turned into a very magnified. So now It's bad, you're bad, I'm bad. It's just all bad, right? Pain's bad. So we get this negative bias, and I can kind of spot somebody at this point, that because I've lived it and I've been around enough people with it, that I can spot what I call a brain on chronic pain just by listening to somebody speak with that negative, you know. Yeah,
Yeah.
it's kind of interesting. So negative bias emotionally, we get confusion in the brain. I don't even remember where I put my keys, and I just put them down, that kind of thing. Um, and that can be um, if you combine that dysregulation in the nervous system, that hypervigilance and that negativity, and now the memory part problem, you've got a problem. Like, as we say in the United States, Houston, we've got a problem,
Yeah.
right? That I just gave you a kind of an overview of what happens to a brain on chronic pain.
Yeah.
So um, those things happen in the brain. There are changes that happen in the brain because of chronic pain. Now, in order to heal chronic pain, we need to heal the changes that happen in the brain because of it. And opiates and benzos don't do that. That's the thing. So interesting. So I broke my arm in 7 pieces when I was about 2 years into my recovery. I went down, and it the blessing in that accident was when we saw the X-ray, the pieces all broke in place. So there was no, all we needed was a cast and time, and there was no, there was no pins and any of that needed. Thank God. It was just like, oh my God, that's amazing. So there, yes, it was a kind of an intense accident, but the grace in that was so powerful. What was interesting was they said, here's your narco, or whatever it was, a Percocet, whatever it was, your opiate, right? In the emergency room. And I was like, well, I'm in recovery from that stuff. And there's like, well, if you don't take this and you come back at midnight because you're going to be in more pain, then we're not going to give it to you then. So I was like, well, shoot. I mean, it was almost like threatening. And here I am, like, I'm trying to be in recovery from chronic pain. And, they come in and threaten. And that's, now I'm dysregulated, not making good sense. I'm not, when I'm just, when we're dysregulated, we don't make good decisions. Right. Right. So I said, fine, I'll take it. And I brought it home and I put it in my bathroom, and I, and I told my sponsor, right? And I didn't take any, but here was the thing that was going on through my mind while I was lying in bed dealing with the pain, because this is quite painful. And it was this. I dropped into meditation because I knew Pete was one of the things that I was already a meditator before I went into Dr. Prescott's program, but I was off all the medicines, and the meditation became more powerful. And so I had a habit of knowing how to drop into the moment anyway. And I've been lying there meditating, just staying present in the breath. It's so simple, right? And I'm feeling the energy. And here's the conversation in the mind. Well, you can take the opiate. And I said, yeah, it's right there. And but what are the what how is that going to help me? They dehydrate the body. So now the body can't get fluid where it needs to heal. It it represses the respiratory system. So now the breath, I can't get oxygen into the cells, and I can't release toxins that sit at the base of the lung. So now my system's polluted. It it paralyzes the digestive tract. So any food I eat isn't going to get in. How are any of these things healing? Right? How are any of these things healing? And that was like, and that's what they do. So I was like, I'm going to sit here and meditate, and I'm going to learn what I can in this meditation space because clearly, like this is my next spiritual lesson. Now, I don't want to come off as saying pain medicine isn't appropriate anytime because it is appropriate. And the way I see it is pain medicine is appropriate when the nervous system is so stressed that you cannot rest. So I've had a kidney stone, which was almost like this. It was almost as much of the bone pain from this thing with the swelling and everything. But it was a really kind of next level because it was so sharp. But kidney stone's pretty epic pain.
Yeah.
And I remember getting a shot of I don't know, some kind of opiate at the time, Dilaudid, I think they gave me. And that's all I just one. That was all I needed. And I was able to handle all the rest of the processing of that. It was a 4 millimeter stone I had that was
Wow.
moving through my moving through the geez. So I'm just saying, like, it was helpful for me to have when I was really like um, so charged up with pain that the nervous system was almost fried because of it,
That makes sense.
right? But the rest of it is like the body knows how to heal, and we need to be addressing the changes. We need to be addressing the landscape of the pain so it doesn't get to the chronic space, right? And these were all the tools that Peter taught us, like don't judge the moment, stay here, use meditation, um, good nutrition, obviously, breath work, stuff like that. But um, the thing is that opiates and benzos um, they don't heal the changes that happen as a result of chronic pain. So what is their benefit? Their benefit is if you're really in extremes. And benzodiazepine is an interesting drug because as far as I know, and there's been a lot of the earlier research came out of England about kind of benzodiazepines and their effects and kind of getting off them. I had to look to England research to help me manage the withdrawal. I mean,
Right.
I was I was at the Betty Ford Center and they have their program, but the fallout from being on benzos for 31 years was pretty epic. And I looked to the English researchers to help me understand what was happening to me, to help me navigate my way through that difficulty, because that part of my recovery was different from the opiate part.
Right.
So
Yeah.
so the problem with benzos is, yes, they'll calm you down from anxiety, but the research is only for a 2 week period, and you're supposed to be taking them sparingly, not regularly. And I was on them regularly for 31 years, so not completely off label.
Yeah.
But there's a lot of people that are off label with the benzos, at least in the United States. I'm not sure what it's like in the UK, but anyway, that's so the problem when Dr. Prescott said, I can help you reset the stress response, he knew a couple things. One, he knew that the brain had been changed by chronic pain. He knew that part. He also knew that the benzodiazepines had been causing panic attacks. So isn't that interesting that a medicine that that's given, that's created to help you manage anxiety, if you take it incorrectly, it'll turn around and bite you right in the butt and give you what you took it for.
Yeah.
In the case of a benzo, I'm not saying about that all medicines, I'm saying that in the case of benzos.
Yeah.
But my doctor didn't know that, and it wasn't in any of the literature. So any of the supporting literature that comes with the medicine, none of that was in there. So I was just like, how did this even happen? And I don't know how it happened, but it did. And I'm here on the other side of it. And one of the things that I am really helpful as now is as a coach to support as a recovery coach to support people who are coming off of benzos and they're working with a doctor, right, to help them. And I'm come in with like the yoga practices and all the things that I did to help me mitigate and ease myself through navigate that space, because it's kind of more than a doctor can say, well, titrate down. Well, now what am I supposed to do with my time as I'm titrating and I'm freaking out? Like, I come in and help with that.
Yeah, I think that part is so, so important because we trust the doctors, don't we, to get advice of how we should navigate these things, whether it's taking them or coming off of medications. And so often we forget that we don't listen to our bodies. That's something that's coming out in a lot of these podcasts is we need to trust our bodies more because they're communicating to us all the time what it needs.
Mhm.
And the answer isn't booking an appointment with the doctor to say, I've got this pain or I'm having panic attacks or that. It's feeling the body and trying to understand what it's telling us first.
For sure. And I think that I'm, doctors have a place, and I think it's important to check in with them when things are going awry.
Definitely.
And I have this to say about pain and discomfort. Pain and discomfort are information. It's not, again, it's not, let's not judge it. It's just information coming into the field.
Yeah.
And I have a teacher and a good dear friend of mine named Gudaprem Singh Khalsa, who says pain is the currency of transformation. Be careful how you spend it. Right?
Yeah.
Right? So
I
if
like,
we're judging our pain, you know, we're putting our attention on it. We learn in yoga, and we learn in it's probably other kind of spiritual places and other psychological places where our attention goes, our energy flows. And our where our attention goes will grow.
yeah.
Now, so if I'm putting my attention on I have pain, I have pain, I have pain, I have pain, I'm going to feel my pain more. If I'm putting my attention on, I'm trying to get rid of this pain and I'm pushing against the pain, I'm going to get more of that too. Right? Now, I tried to distract myself away from the pain. And you know what happened? The pain didn't go away. It stayed there, but my attention was somewhere else for a while. But my body was still stressed and I still had that chronic stress habit. So it's not so simple as divert your attention away from the pain. In this space, it doesn't work like that. But I'm just trying to kind of bring in some nuances and some sayings that people say, and to kind of say, well, this is what that actually implies. Like when we do this or when you hear that, this is kind of what's really happening, just in terms of what we understand about chronic pain.
Yeah, I think that's brilliant. I have sciatica. I damaged my back when I was 19, 20, and it didn't get treated for a while. And it sort of stuck twisted.
Mm.
And they wouldn't x-ray me or anything because I was a young female. It was over my ovaries, and they sort of just forgot about me. So it's stuck twisted. A chiropractor opened, and I was lucky enough to see it open and thought give it a try. And then I was back working, which was fantastic. But I still have that pain now, and the sciatica has got quite bad. And when I went to the hospital, straight away they said to me, just get pregabalin off your doctor. And I was like, no, the
You
addicted
mean
mind.
gabapentin?
Yeah,
Uh-huh.
it's like
I
that,
know what it is.
unfortunately.
Yeah. Uh-huh.
Yeah. So that was their answer. Just ask your doctor for that. Goodbye. And as you said, that's how they respond. And the addicted mind, as I have, went, that might be quite nice. I don't really need it. that it might be nice. But me in my recovery, I'm like, you don't need it. What you need to do is more exercises to support your back, your posture, you know. But that was their answer straight away. Just gabapentin. See you later.
Well, yeah, that gabapentin, as far as I know, isn't addictive, but not that I'm a doctor, but I don't know that it heals the cause is the thing. And nerve pain is different than striated muscle pain is different than smooth muscle pain is different from gut pain. They're all pains I know well, and I have seen the differences. Um, I know that because I had sciatica too. Um, I know that managing sciatica was different than managing the pain that I had in my lower back, which was the sciatica was part of it, but not, it was different.
Yeah.
Um, I would have asked a chiropractor, a physical therapist, like you're going on. That's for me, is like, I want a holistic approach. Like,
Yeah.
what's happening with my diet? Is there one of the things that I didn't realize until much later, like when I was clean, um, was that my low back pain was also the result of um, remember I said that the opiates paralyze the digestive tract? Well, they also will, and this also I said that it's dehydrating. So it creates constipation in the gut, uh, in the system. And so now I had a back problem that was caught, that where the bone wasn't, that healing there was being mediated by the pain medicine itself, and I was getting a backed up lower intestinal thing happening, and that was creating pain in my back too. So anything, so I've learned, like, any kind of pain in my back, first thing I do is what's happening with my gut. Like, what's happening there? Then I start doing, like, well, do I need to go see my chiropractor, etc. Right? But a holistic is acupuncture is also very good. Like, I have an acupuncturist who's specialized in neurological acupuncture, which would be like a great thing for. I would definitely send you to Sarah. I want to go see Sarah. She might be able. So I'm just saying, like, there are other modalities that can be helpful.
There are so many, aren't there? And instead of just reaching straight for the painkillers,
Yeah.
and quite rightly, as you said, they have their time and
Mhm.
place, and then they are necessary. So, what is it that you cover in your book? Tell me about your book.
Oh yeah. So so that's it. So why did I write it? Like, how is it different than other ones in the field? I wanted to write a book for doctors and nurses and family members and friends of chronic pain sufferers that would be able to really understand what's happening on the inside with a chronic pain sufferer, including what's happening in the stories they're telling themselves, the kind of the mental landscape. Because doctors can kind of assess out the physical, but the mental part is something that people just don't get. Because one of the things about chronic pain sufferers, and like I said, I've sat with thousands of them over the years. We don't tell the truth. We either don't say anything at all, or we complain all the time, and neither of those is the truth, right?
Yeah,
Remember, chronic pain changes the brain. That negative thinking, so that complaining all the time is a brain on chronic pain, right? And then you get somebody like me who's like got other issues that came before the chronic pain came, and it was safer for me to keep quiet than to say anything. That was my strategy for getting by in life. Don't say anything. especially when you're stressed. Don't say anything, right? So I'm just giving you, like, we say nothing or we say everything and it's negative. So we don't tell the truth. So I wanted people to understand this, which is what I wrote the book about. And I wanted them to understand the tools that I was using. So it's not so much about my story. It's really more about the story of a chronic pain, the landscape of a person in chronic pain, and the tools that I used, that Peter taught, that, and kind of the way I brought it in, to heal from chronic pain. And I added, because he doesn't talk about this in his book, I added ancestral clearing, yoga, gratitude, um, these other things that were so helpful. The ancestral clearing piece is very interesting to me, but my science mind is like, because I experienced John Newton in Dr. Prescott's pain management program. He's an ancestral clearing practitioner. That's what he does. And I was so not ready. I was like not ready for the method. I didn't know anything about it. I just, nobody said this is coming or anything, and I didn't know what it was. But I experienced the effect of it, and I was just like, holy crap, what is this? Like, I know something's happening here. Can you measure it? Is it repeatable? And does he teach this thing? Because it was remarkable to me. And it's kind of based on the patterns that we come in with. It's based on epigenetics, which I understood that space. We come in with certain patterns imprinted. It's from an evolutionary point of view, I kind of look at it as uh, there's information that flows from one generation to the next, and the information that comes in for us in this generation, just an example, is kind of the system's best guess at what we're going to be having to deal with, right, in this iteration, right? Yeah. So I mean, I could go into a whole thing around that, but part of that is the unfinished business of unresolved stuff in the lineage. Like, my parents were in World War II, and my grandfather was in World War I, and my father and grandfather were in the Depression, and so on and on and on. So there's all kinds of little patterns that we come in with, where we're kind of ready to meet the environment with certain strategies. And one of them that people will recognize right off the bat is worrying, like the habit of worrying, which people in the addiction space know well. This is a chronic pain thing, right? This chronic pain thing, but that can be from the lineage. Also, there was a lot of scarcity in the lineage, and so why wouldn't that feed the worry? the worry pattern, right? What are we worried about? We're worried about surviving, right? So anyway, there are patterns that we have, that we come in with, and ancestral clearing helps us uh, rewire those, release the grip of those, and I talk about that in the book. Yeah, and I mostly what I do anymore, and have done since 2014. I took the first training I could out of Peter's program, um, is ancestral clearing. And I just, like, it's the first thing I do with a new client in recovery. We do an ancestral clearing, because if we can clear that burden, now we can deal with what's left, right?
Nice. Tell me a bit more about that, because I know it's something not um not the actual clearing, but it's something that's been brought up a few times in recent trainings that I've done with trauma, and a few people have mentioned it, and genetics through generations. So I think that's
Yeah,
brilliant that you've covered that. Tell us what it is, and what it sort of
yeah,
means. You briefly touched
yeah.
on it.
So yeah, the remember, we started this with saying that we heal in the all that is, not just in the part that science can measure, observe, and describe. So I can sit here and lay down the science of ancestral clearing to the extent that we know, not that it per se has been studied, but we have scientists in the field like Rachel Yehuda and her team that have done work on um, uh, the differences between survivors and descendants of survivors in the Holocaust versus the population that didn't experience that, and the differences in their cortisol levels, which is amazing to me. So that's how they manage stress are different. They have different ways. So I can sit here and talk to you about the science of that, understand that yes, science has got kind of a handle on this, and we're also dealing with uh, the energies outside of science, because in ancestral clearing, we're bringing in the energy of prayer. We actually, we're calling on source energy, creator, God, whatever you want to call that. We're calling on it to help us release that which no longer serves us. So, as a practitioner, what I do is I really kind of sit in presence, and I'm kind of like a um, between the client or whoever wants the clearing and creator, and really I'm really kind of just holding space, because the person comes in and maybe they don't even know what their pattern is, but I can sit with them and ask them a few very few pointed questions, and I'll see an entry point. Oh, I see you have a worry pattern, right? For instance, right? And John teaches about John Newton of Health Beyond Belief. He teaches about, at this point, it's about 30 different ways to get at the burden. So there's all these different ways we can use to get at the burden. But whatever it is, we're calling on source to come in and help the client release that which no longer serves them. It's pretty remarkable. And there is data on the power of prayer. So that's a little bit of the science of it. But really, you're asking me a question, which is kind of like, you could have asked me, what is chocolate like?
Yeah.
What is chocolate, or what is ice cream? I can't actually explain that to you without giving you the experience of it. So, but we understand that we come into this life with the gifts and the burdens of our ancestors. Remember, I said I came in with persistence and some, just like, mad resilience, right? And I came in with other things, right? I came in with a lot of I can't really even explain it properly in words other than to say weight around war, like massive weight around war. And I didn't even know that I knew that it was a thing, but I didn't realize the extent of the weight of that bit that I was carrying until I was able to release it through ancestral clearing. I was astonished. I was astonished. I was just like, that's why I was like, how does this even work? This is amazing. Like my science mind wanted to know all the measurables.
Love that.
Yeah.
So do people need to be clean of substances and whatever to do this?
Oh, that's a great question. Yeah, I would say, let me put it this way. Um, I People that are clear of substances are going to notice the effect of ancestral clearing more than people that are on substances. Um, my experience really over all these years and kind of watching, again, science mind, always kind of looking, just like it's kind of part of who I am. my experience tells me that um, we we're not we're not really we're not really tapping fully into what's going on in any given moment. We're kind of at the surface, and in the chronic pain space, or in the trauma recovery space, where we've disconnected from our true self because we'd rather go for attachment to others, we'd rather go for connection than authenticity. That's kind of like something that we know. So um, I've gone off on a little bit of a tangent, but
Fine.
um, that that's that's an important piece around, because we don't, when we're that disconnected and not really feeling our true self, we're not really aware of the effects that things have on us. I'm not sure that really answers your question.
I, I think so because I think there's so many different types of therapy, isn't there? And um, I remember working with one person most recently. It was about a year ago, and they came up with things like I've been different therapy for a long, long time, but they mentioned things to me such as the one thing that stood out, and it's never ever been said to me before, is how mad I get over injustices in the world.
Oh my God, that's my button.
Is it? Wow. And you know what? He said that to me, and then suddenly so much made sense. And I could see it and I could sort of track it back.
Mhm.
Um, but I was what, 42. So it's taken 42 years for somebody to say that and me go, wow, yeah, you're right.
Mm.
Um, so I really encourage trying different things and
Yeah.
different people, and because you never
Mhm.
know what you're going to get from that.
Yeah, I remember the first time I sat in front of John Newton and had a session with him. One of the first thing that I remember out of his mouth was he was clearing for he was doing an out loud clearing, and he said, for all the bullies in your life. So remember, it's a kind of in a form of a prayer. So we're asking Creator for all the bullies in my life. He's on my behalf, right? Please help us, help her release that which no longer serves her, right? Forgive and release. And forgive meaning offering up which no longer serves. And I had like this kind of like a big light bulb went off when he said, all the bullies in your life. It never occurred to me that I had any bullies in my life because of my perspective and my denial and my, just my conditioning, until he brought it in. And all of a sudden, it's like the nickel dropped, and I was like, oh, and there it was. It was just, I felt the weight of that release. So it was quite, um, so that was private, but that was my first private with him, but I had already had a group thing with him when I don't even know what was releasing, but I was, my pain was disappearing, and everyone else in the room was experiencing it too. I was scratching my head going, what in the world is happening in this room? Right. I just had
That's
never had any experience like that. And it never even occurred to me that such a thing could happen. So it was so outside of my realm of understanding. But remember, I had had that years and years and years ago. I had realized science, limiting, self-limiting framework, healing, all it is there and everywhere else. So I knew there was a bunch of stuff I was missing. And that was a piece. Yeah.
amazing. I think that's fantastic. Just tell me um, where people can find you, the name of your book again and any information that we need to know.
Sure. Thanks so much. Thanks so much, Emma. So you can find me at my website, which is Elizabeth, got to put a hyphen in, kipp.com. So Elizabeth hyphen KIPP.com. Got to put the dash in there. Otherwise, you'll find the other Elizabeth Kipp, who's a web designer and a photographer, and she's amazing, but she's not me. You can find me there. There's all kinds of free resources there. You can book a session. You can do a free introductory session. Lots of, like I said, you can get my social media on there. Easy to contact me. My book, you can also find there, is The Way Through Chronic Pain, Tools to Reclaim Your Healing Power. And thank you so much for having me on as a guest today.
Oh no, it's an absolute pleasure. And it's been absolutely fascinating. And I think it's going to help so many people because, and that's what I like doing, bringing different people on from different perspectives, different therapies. And it's going to help so many people. So thank you so much.
Oh, my pleasure.